جيت من العراق.
كانت تعاني زوجتي من مرض ورم بالإذن اليسرى. سويت العملية أول شيء بالعراق ما نجحت، وسويت العملية الثانية بجنوب الهند بحيدر أباد بمستشفى أشودا، كان شلت 95% وبقي 5%. ورجعت العراق ورا شهر، للعراق رجعت ورا سنة و8 أشهر، عدت الرنين طلع الورم منتشر بإذن الوسطى وركبتها والدماغ. بعدين طلبت الوزارة العراقية إلى السفر خارج الجمهورية العراقية، فوافقت الوزارة فدزون إلى مستشفى دلهي كوارجي.
She came here with the difficulty in hearing and the vertigo episode, and there were the weakness in the facial nerves area, and there were deviation of the angle of the mouth, and she was unable to close her eyes. Here the patient came with this problem. We did the complete investigation including the CT scan of the temporal bone, MRI brain, MRI with angiography, and found it is a glomus jugulare tumor.
ووافق المدير على العملية مع زوجتي.
And before surgery, we make an evaluations regarding the blood investigation and other investigation, and PSC fitness was done, and the patient was finally taken to the theatre. That cervicomastoid incision was taken, and the patient was being informed regarding the future outcome and the concerned proximity of the tumor with the lower cranial nerve like the 7th nerve, 8th nerve, 9th, 10th, 11th, 12th cranial nerves, and the probable chances of the paralysis post surgery. But we were lucky that the surgery was done very uneventfully.
وسوى العملية الحمد لله والشكر نجحت باي المستشفى.
And the patient responded very well after surgeries, and we could be able to remove the complete tumor from the very vital area of the brain and a skull base, especially the lateral skull base, common carotid artery, internal carotid artery, vagus nerve, a spinal accessory nerve, hypoglossal nerve, lingual nerve, and the facial nerve was preserved. Patient angle of mouth was not deviated. Patient found relief in the terms of the headache, and her hearing was not improved, but the patient find good, and she is responding very well after surgery, and now the patient's facial paralysis has been improved.
وأحمد الله والشكر نجحت العملية 100%، وشال كل الورم بإذنها والحمد لله والشكر والدكتور مان.
The carry home message from this surgery is only that such a tumor is already a benign tumor, but it has a potential to invade the very vital structure and a very high propensity to invade the brain also. So we shall go to the hospital by the coming of the diagnosis of the giddiness, the vertigo, hearing loss, and those whoever have been complaining from the vertigo with the headache shall go to the nearby doctor and go for an evaluation with the CT and MRI, and to exclude it the glomus tumor or not, because this glomus tumor is a benign but locally invading tumor, and it can invade the vital structure and cause damage to the bone and gives a very lethal consequences, and sometimes the threatening to your vital organs. So we shall be following this tumor and shall go to the nearby doctor for an evaluations.
مشكور الدكتور هانن ومدير المستشفى وكوي وارجي.